All right. Hello. Welcome back to my channel, guys. This is the PTA coach on this beautiful Sunday afternoon, guys. The weather is so nice, and we will be going through some very nice things on this channel. Okay. I appreciate you guys for everything, all the support that you've given me, all the tips, all the thumbs up. Hey, I appreciate every single thing. Okay. So I am a PTA, physical therapist assistant in the state of Texas. I've been licensed for some time, guys, and on this channel, we go through questions, things to equip us to go out there and just skyrocket this exam and pass. Okay. And so I share a lot of tips on here. I go through questions, and we also host workshops. If you want more information, just send an email. The email is my last name, aka LUSO, the number 40 at gmail.com. And I'll go ahead and put that in right now before we continue. Okay. So today we're going to be covering other systems. Other systems. Of course, a lot of you know that on the actual exam, there's 5 major sections. And one of the sections we're going to cover today is other systems. Okay, so I will be going through some practice style questions and showing you guys a lot of wisdom and techniques to get this thing done. It's possible, guys. I did it. Okay, and so I believe that all of you can do the same thing. And so my email address is right there, akluso40 at gmail.com. If you need to talk to me one-on-one, that is the place. If you need to book workshop sessions, okay, like the practice review workshops, you can do it on the same email, okay? So just reach out to me. Also, if you're in a school, okay, and you and your classmates are trying to team up and get this thing done, I am also your coach for that, okay? So that is my email. Now, what I'm going to do right away is share my screen. And like I said earlier, we're going to be covering other systems today. Okay, so we'll be covering that, and that's going to be the bulk of what we talk about for today. Give me 1 second, guys. I got to make sure I'm sharing the correct screen. Okay. All right, let's see here. The other systems. Let's go here. There it is. There it is. All right, so real quick, let's go ahead and go through these questions, okay? A 55-year-old female is referred for physical therapy due to progressive bilateral joint pain in the distal extremities. Given the presence of synovitis, okay, and the pattern of stiffness improving with movement, which diagnosis is most supported by these findings? Is it A, osteoarthritis? Is it B, polymyalgia rheumatica? Is it C, rheumatoid arthritis? Is it D, scleroderma? Okay, so which one is it, guys? Now, one tip that I share with a lot of us, and we go into this into detail regarding this in the workshop, if I can get the words out. Sorry, guys, it's Sunday, okay? We're going to highlight the key words, okay? Progressive, okay? Let's just go ahead and highlight that. Bilateral joint pain in the distal extremities, okay? Let's go ahead and highlight that. Pattern of stiffness improving with movement. Let's highlight that, okay? So these are the key words, and the reason I highlighted this is, one, I've told a lot of us in the past that all the information that we need to answer a question is in the question. If only we can just quickly pick out those key words. Now, based on these keywords alone, guys, I know because I've been doing this for a while, I can kind of narrow it down to what it could be, what the answer could be for number 1, okay? What do we know about osteoarthritis, okay? Pain seems to increase with movement, right? What do we know about polymyalgia rheumatica? The pain, the stiffness that we have is mostly in our hips and our shoulders, okay? So what is rheumatoid arthritis? Once again, for osteoarthritis, right? It's symmetrical. I'm sorry, guys. It's asymmetrical. Sorry. Okay. Rheumatoid arthritis. How does the stiffness present? It's symmetrical, which means it's on both sides. Okay. I just gave away the answer pretty much. So we have to learn to pick out the key words, okay? And also, not only that, I mean, look at all these things right here, right? Like option A, option B, option C, option D. Make sure you know what they are, right? Make sure you know what they are. Make sure you know what differentiates one from the other. For example, what's the difference between osteoarthritis and rheumatoid arthritis? Okay, so that right there is like a nice little mini study session right there. Okay, so learn to pick out the keywords. Also, another thing that I've said before in the past is don't try to add more information to the question than what is provided. Just go off of exactly what's being asked. Okay. Now, let's go to question number 2. A physical therapist assistant treats a patient with chronic venous insufficiency in their right lower extremity. The patient has an ankle brachial index of 0.88 in the affected lower extremity. Which of the following decisions regarding compression is the assistant most likely to make? Now, once again, let's highlight the key words quickly. First one is chronic venous insufficiency. I'm going to highlight that quickly. Right lower extremity. Do we need to know? Yeah, that's fine. Let's just highlight that quickly. Ankle brachial index of 0.88. Guys, I want you to go back and review what is ankle brachial index? What is it measuring? Okay. It's a non-invasive test for what? For peripheral arterial disease. Why do we need to measure that? We're trying to figure out arterial perfusion, right? Now, what about the numbers? What is an appropriate number? What is a number that is too low? I want you guys to go back and review that. Why do I say this? Because they've mentioned here that it's 0.88. That's important. That is important information to know, because if this said something like 0.5, right, the answer might change. So I want you guys to go review ankle brachial index. I also want you to review how it is calculated, okay? Review how it is calculated. You check what? The systolic ankle blood pressure, okay? And you also check the brachial. You check the systolic for the upper extremities, and you also check the systolic for the lower extremities, right? And there's a calculation that is involved. I don't want to go into too much detail, but I want you guys to actually go back and review that and come back and check out this question, okay? Once again, in my workshops, when I say we don't go from scratch, what I do expect when you come in is that you've actually done your review. Like you've done your studying, you've done your reviewing, and I'm showing you pretty much like strategies, a lot of strategies. So it's not much of your knowledge base, because I know a lot of you, all of you, not a lot of you, all of you are very, very intelligent. I know that, okay? You probably read more than I would ever read, because guess what? I'm not in PTA school. I'm actually out there working, right? So the knowledge base for a lot of you is there. And then if there's a slight lack, then I will tell you guys, okay, for example, things like this. If you're not too sure about it, I'll tell you, hey, go back and review your ankle brachial index, okay? Go back and review stuff like chronic venous insufficiency. Why is that the case? What's going on with that? I will tell you things like that, okay? So when you come into the workshop, we're doing a lot of strategies, techniques. I'm using words of wisdom, showing you ways to navigate this exam, because I've told a lot of us in the past that this exam is not a walk in the park. I'm very serious about that. And if you guys think I'm not saying anything that is right, I want you to ask other people that who took this exam in the past. It's a 180 hot questions, okay? 180 very hot questions. So I want all of us to succeed on this exam, okay? Let's go to number 3, and we're going to stop there for now. A physical therapist assistant examines a patient diagnosed with piriformis syndrome, okay? The patient reports experiencing pain in the lower back and buttock region for the last 3 weeks. Which motion should the assistant expect to be weak and painful during muscle testing based on the patient's diagnosis? Okay. A, is it adduction and lateral rotation of the hip? B, is it flexion and medial rotation of the hip? C, is it abduction and lateral rotation of the hip? D, is it extension and medial rotation of the hip? Which one is it? Now, I've also shared with you guys on this channel, and I want you to go verify everything I'm talking about, okay? If there's any error in anything that I say, you feel it's not correct or it needs correction, feel free to correct me, okay? Now, for muscles, I want to say this real quick. Muscles have actions, right? Like either they're doing flexion, they're doing extension, abduction, adduction, medial rotation, lateral rotation, right? Those are all actions of the muscle. And I told a lot of us on this channel, if you're trying to stretch a muscle, you perform the opposite action of that muscle. Now, this is not talking about stretching. I'm just reminding you guys of some of the things I've talked about when it comes to muscle and muscle actions. Now, who on here right now can tell me what is the action of the piriformis muscle? Okay. What is the action of the piriformis muscle? If you can tell me what the action is, pretty much you've answered this question, because what is it talking about right here? Okay. What will be painful during muscle testing? You guys have read about manual muscle testing, right? When a muscle is being tested, you're trying to perform the action of that muscle to find out how strong it is or how weak it is. So in this case, with this piriformis syndrome, okay, which motion should the assistant expect to be weak and painful during muscle testing based on the patient's diagnosis? So if you pretty much know the action of this muscle, guys, you've got it right. Once again, go back and review your muscles, know the actions of those muscles, okay? And if you know the actions of the muscles, most likely, if you're being asked of a question on how to stretch that muscle or those muscles, you'll be able to answer the question. So muscle action, very important. Bicep, piriformis, what else, guys? Tricep, you name it, okay? Plantar flexors, dorsiflexors, all that good stuff. You want to know the actions of the muscles. If they ask you stuff like lateral rotation of the shoulder, okay, what muscles are involved in that? Okay, the way I remember it, guys, is TIP, T-I-P, okay? You have your teres minor, you have your infraspinatus, okay, and you have your posterior deltoid. So just little things like that. So once again, find acronyms that work for you that help you to recall a lot of information, because you will be asked, right, and you have to be able to recall to answer these questions. All right, I'm going to stop sharing my screen in a second. I just want to share this with you guys quickly. Today it's all about the other systems, and we covered some sample questions that you guys can use to review. Let me stop sharing my screen, and let's see here. Okay, so let's go here. All right. So once again, we host workshops weekly, also on weekends. If you want more information, send an email to my address. My email address is akaluso, the number 40 at gmail.com. That's akaluso, the number 40 at gmail.com. Okay. So send an email, and so we can set up your time. If it's a one-on-one, like I said earlier, we can do that. If it's like a group, we can also do that. We have upcoming workshops during the weekends. Want more information, send an email. Okay. And so, like I said earlier, and I'm going to wrap up with this, we're going to have 180 hot questions on the actual state board exam. Okay. And we have to pass. A 600 score and above is a pass, right? That's just what it is. 600 score and above is a pass. At the same time, I don't want you guys just aiming for the bare minimum, okay? You want to take your practice exams and know where you stand, because those practice exams will reveal areas of strength and areas of weakness, okay? And we need to focus on getting better so we can pass the exam. Now, the next exam, speaking of exams coming up, I believe is in July, and there's one for October. So you don't want to wait till 3 weeks before the time to start your review, because it's a lot, guys. I've said this in the past, like, I don't know how I was able to go through this book. I know, guys, I'm an old school guy, right? I do a lot of stuff on the books. I also go on apps and study. But back then, I can't believe that I went through this book. It's a lot of information. right? I'm not trying to discourage anybody on here, but it takes a lot. And we have to actually hone down and use our skills and strategies and have that mindset to go in and pass this exam. Now, how often should you study daily? It's up to you. I would say for me, I would do like 3 hours, right? 3 to 3.5 hours, but not in one stretch. For example, I would study for, let's say, back then, let's say like 30 minutes, take a break, come back again, do another 30 minutes, take a break. So kind of like space out my time and review. Okay. So all these things are possible. Now, I've also said on this channel that I think it's almost impossible to pass this exam if we don't hit the three major areas. Those three major areas are loaded with questions. So when you talk about things like your cardiopulmonary, okay, when you talk about things like your musculoskeletal, okay, and also your nervous system, those three sections alone account for like 60% of what's going to be on the actual exam. Okay, so it's heavy, it's loaded with questions. And like I said, once again, it's almost impossible to pass the exam if we don't hit those three main areas. Now, the other two areas, like today, we talked about other systems and non-systems. Are they important? Yes, they are, right? They're also very important, but I feel like those first three is pretty heavy. It has a high percentage of questions, and so we have to like make sure we get it. Now, I don't know what you guys use to study. Some of us out there use like apps, websites. It's fine. Some of us use the book. Find a combination of things that work. And if you feel like you don't have enough resources, reach out to me also, send an email, and I can share with you like things that I feel would help. In this day and age, there's almost like apps for every single thing, right? There's apps for everything. So possibly more apps that could help. It could be more books that could help. It could be more websites. It could be watching videos, right? And why do I say all these things? Because the FSBPT, according to what I read on their website, will be asking well-structured questions, right? Like well-structured questions. So we also have to be well-structured in our approach, okay? And some of the things I present here, for some of you, it might be basic. For some of you, it might be intermediate. For some of you, it might be advanced, right? It all depends. You can run into questions that would ask things like, what three bones make up the knee joint, right? For a lot of us, that's like an easy question. I can't believe you're asking me that. For some of us, it might be intermediate, and for some of us, it might be advanced, right? So for everybody, there's a level of difficulty. For some of us, it's something that we already know. For some of us, it might be a struggle. Okay. Once again, anatomy. I can't say enough about anatomy, right? Like I talked about the muscles earlier. Go through your muscles. I mean, there's so many muscles in the body. I do understand, but go through them. Okay. Bring out that old school anatomy book that has a breakdown of where the muscles are and actions of the muscles and the origin of the muscle, the insertion of the muscle. Go through that, right? When it comes to pathologies, also go through that. Learn about the different pathologies. How do they present? What causes those pathologies? Okay. And what is the physical therapy intervention from your standpoint? So there's just a lot of things, and I can't say it all in one video. And once again, some of you might not be using this book. Okay. I'm not being sponsored by Score Builders, but it's my preferred choice. It's this, and then I have apps that I use to, like review and do stuff. But find out what works for you and make sure you use it. All right, so that's about it for today, guys. Hopefully tomorrow I'll try to come on and cover maybe it might be musculoskeletal or cardiopulmonary or non-systems, other systems. I try to cover some more stuff to help all of us go out there and succeed. So I appreciate all of you for liking, sharing, and subscribing to my channel. Make sure you hit the notification button so you know exactly when I come on. And I appreciate you guys for all the support, for checking out my shorts, for checking out my videos. Lately, it's been a lot about review questions, right? Because I know a lot of us are prepping for this. And so I want all of us to be ready so we can go out there and succeed. All right. So I'll talk to you guys soon, and make sure you have a great day. Stay blessed. Bye-bye.